5 years ago, my persistent joint discomfort led me down a rabbit hole of natural remedies. Among the countless options, cloves stood out for their anti-inflammatory properties. The results were promising, but then came the unexpected side effects when I combined them with certain medications and foods. That's when I realized there's more to cloves than most people know. Cloves contain eugenol, a compound with remarkable health benefits, but also potential risks when improperly combined. According to research published in the Journal of Agricultural and Food Chemistry, eugenol can interact with certain medications and foods in ways that might surprise you and your doctor. The World Health Organization recognizes cloves for their therapeutic properties, but also cautions about their potent nature. Most people don't realize that this common spice can influence how certain medications work in your body. A study from the National Institutes of Health found that cloves can alter blood clotting mechanisms, potentially creating dangerous situations when combined with blood thinners like warfarin. What shocked my physician was how cloves amplified the effects of my blood pressure medication. The Mayo Clinic confirms this interaction, noting that eugenol can enhance the effects of certain hypertension drugs, potentially causing blood pressure to drop too low. This isn't just theory. I experienced dizziness firsthand before understanding this connection. Here are the 5 most dangerous clove combinations you should know about. 1. Cloves and blood thinners. This combination can increase the risk of bleeding. A 2019 study in the Journal of Thrombosis and Hemostasis demonstrated that eugenol inhibits platelet aggregation, essentially doubling down on the effects of medications like aspirin or warfarin. If you're taking any blood-thinning medication, consult your doctor before adding cloves to your diet. 2. Cloves and diabetes medications. My colleague who manages type 2 diabetes noticed unusual drops in blood sugar after enjoying our clove-infused holiday cookies. Research from the American Diabetes Association supports this observation, showing that cloves can enhance insulin sensitivity. While this might sound beneficial, unexpected blood sugar drops can be dangerous. Monitor your levels closely if you use both. 3. Cloves and certain antibiotics. Cloves have natural antibacterial properties that can actually compete with certain antibiotics. Research published in Antimicrobial Agents and Chemotherapy found that combining them might reduce the effectiveness of quinolone antibiotics. Always separate your clove consumption from antibiotic doses by at least 2 hours. 4. Cloves and liver medications. The liver metabolizes both cloves and many medications. When combined, they compete for the same metabolic pathways. A study in hepatology showed that this competition can increase the concentration of certain drugs in the bloodstream, potentially reaching toxic levels. People with liver conditions need to be particularly cautious. 5. Cloves and alcohol. This common combination, often found in holiday drinks, can intensify alcohol's effects. Research in food and chemical toxicology demonstrates that eugenol alters alcohol metabolism, potentially leading to increased intoxication and greater strain on the liver. I learned these lessons through personal experience and careful research, not from alarmist headlines. What makes these interactions particularly concerning is how common cloves are in our daily lives, from dental products to seasonal foods and traditional remedies. The science behind these interactions involves how eugenol influences cytochrome P450 enzymes in the liver. These enzymes are responsible for metabolizing many medications, and when cloves alter their function, medication levels can become unpredictable. It's not that cloves are dangerous by themselves. They're incredibly beneficial in appropriate contexts, but their interactions require awareness. Incorporating cloves safely into your diet is still possible with some practical guidelines. First, timing matters. Separate clove consumption from medication by at least 2 hours. Second, moderation is key. Culinary amounts 1/4 to 1/2 teaspoon daily are generally safe for most people, while concentrated supplements deserve extra caution. Third, be particularly vigilant if you're in a high-risk category, such as pregnancy, scheduled for surgery, or taking multiple medications. My approach now includes discussing my clove consumption with my healthcare provider during medication reviews. I've found that transparency about all supplements and spices leads to better health decisions. Many doctors are becoming more aware of food-drug interactions, but they can only help if they know what you're consuming.